COVID-19 infections have been steadily rising in the country of recent. 23 new cases were confirmed today, pushing the grand total to 616. 17 of these are frontline healthcare workers. One of the 23 new cases that were announced today is a health worker. The growing number will prompt renewed calls to ensure health workers have PPE. The shortage of PPE has not escaped the eye of the Uganda Medical Workers Association.
Either the PPE may not be there, or somebody loses the guard, either because they have not been trained enough or because they are not being supervised enough.
It is true that PPEs are not enough, and they will never be enough because they are consumptive. You consume, you want more. You consume, you want more. We bring, they consume. So it can never be enough. We try to make sure that we supply them, but they are not enough for sure. And even now we are in the process of procuring more.
The permanent secretary for the Ministry of Health told NTV a possible way through which their staff got infected.
I was talking to one of the colleagues who got infected. And what happened, he was in a meeting, and it was a hot sun, very, very hot. They had been, working the whole day, and it was really hot. And they were meeting leaders there. And they brought chairs and sat, and of course he was holding the chairs. So what he did, he picked the handkerchief and wiped his face, and even, sneezed in and what. He suspected, because that's the only time he remembers, he touched his face. So it is possible that in these meetings, even where you don't have to be putting on full PPE, even just where we are seated, you can get infected.
According to Dr. Atwine, the workers are now receiving treatment at Mulago and Entebbe Grade B Hospital.
Most of them are very asymptomatic. They are there seated. Actually, some of them are working, even on the ward. They are writing reports, they are doing what? They are there, they are working, but they are on the ward, they are just isolated, but they are working. Our worry is that when more people get infected, others get demoralized. And that's why we keep on just engaging them and encouraging them and counseling them. And even now, we just want to tell the health workers out there that we do appreciate their work, we do appreciate their contribution, and they stay on the course.
Since most of the people have not been staying in one place, the Ministry of Health says they have zeroed down on their contacts.
Even in our offices, the contacts they were working with, we have quarantined them.
So what needs to be done to arrest the situation before it worsens?
Training to do the right thing. Secondly, to use the right thing. Thirdly, to consistently use the right thing. Fourthly, supervision, to make sure that somebody is watching that the right thing is being done.
For the frontliners, who include doctors and other personnel who are involved in the fight against COVID-19, in order for them not to contract the deadly virus, it is important for them to remain alert at all times. And even for the bosses or supervisors who are in the field with them, according to the Uganda Medical Association, these people should not be overstretched or overworked, because if they do so, they tend to put their guard down. Sudhir Yarhanga, NTV.